Hi, I'm Dr. JJ Whicker.
And I'm Dr. Lindsey Tubaugh, and today we're going to be talking about one of our favorite topics because we both have worked in newborn hearing screening programs and run newborn hearing screening programs at hospitals and newborn intensive care units, and it's something that we love and we're really passionate about. So today we're going to be talking about newborn hearing screenings.
But before we get into this coffee talk, we wanted to invite you to please like and subscribe to our YouTube channel and click that notification bell so that as we come out with new content, you can share with your friends and family. So, newborn hearing screening.
Yeah, so a lot of parents who are expecting a child may hear that their baby will get a newborn hearing screening in the hospital after they're born. And that is absolutely accurate. In most of the United States, it's a mandate that a newborn will get a hearing screening at birth. And even in other countries, it's typically done. So it's something that wherever you're watching this is likely something that's being done in your hospital. And check, because if it's not, then you want that to be done. You want to be sure to have that screening. So important to understand that the initial screening is just that. It's a screening. It's not a diagnostic test. It's not going to tell you thresholds of your child's hearing. It isn't going up to the child and clapping in their ear. Did that scare you?
Thank you for bringing it. No, I'm just glad you brought that up.
But so many people ask, when I ran my newborn hearing screening program, so many parents were like, so how do you test a newborn's hearing? And so that's exactly what we're going to address.
Yep. So testing a newborn's hearing, we use some technology that basically is letting us know whether or not the cochlea, which is the little snail-shaped organ of hearing, is doing its job. So that's exactly why Dr. Tubaugh is right. It's not a test. We can kind of just see in a pass-fail way whether or not the cochlea is amplifying soft sounds the way it should to let us guess whether or not there's going to be a hearing loss present.
Yeah. So it's a non-invasive test. All that is done, there's two different tests that actually can be utilized in a newborn hearing screening. The first test, called otoacoustic emissions, they take your baby. Sometimes they'll even do it in your room, but a lot of times they'll take them to a really quiet place because it has to be very quiet. Your baby needs to be asleep or can be awake, but it has to be very quiet for the test. Put a tiny little probe in the ear, doesn't hurt at all. And I think that's really important. As a new parent, the last thing you want is to think about your child, your baby, getting hurt in any way. And so it's really important to understand this is a very non-invasive test. It's not traumatizing to the child at all. The audiologist or the hearing screener or the nurse will put a little probe into the ear with this test. It shoots, shoots is not the right word, but it plays some sounds into the ear. And what we're trying to do is we're trying to elicit a sound response back from the inner ear. So there's also a little microphone in that probe that's trying to detect a sound coming back out. And if we get those sounds at certain frequencies that are coming back, we typically can rule out hearing loss, anything greater than a mild hearing loss. So again, not a diagnostic test. There are some things that could be going on auditorily that won't be detected by this test, but in general, it correlates well with normal or near normal hearing. The second test that can be done is an automated auditory brainstem response test. And that is a little bit different. It might use some sticker electrodes, but similarly, a sound is played into the infant's ear. And in this case, we're looking for a brainstem's response to sound. And if we get that sound at, typically it's 30 or 35 decibels. Yeah. So normal hearing, we consider at about 15 decibels or less. Sorry, that's kind of a difficult way to describe it, but we're sending a sound in so that we really can try to detect any type of abnormality. If we don't get a response from that brainstem at that, then we know that something might be wrong.
Right.
So one of the things that can happen a lot in infants that are really, really young, so I'm talking under 24 hours old, is they can still have vernix, which is the white stuff on the skin after a baby's born. It can kind of get gunked up in the ears and needs to have time to clear out. So don't panic if your baby doesn't pass the newborn hearing screening in the beginning. A lot of times it's because of that. Studies have also found that amniotic fluid can be present in the middle ear space for the first 24 hours of life. And so it also could be a little bit of that. But one of our pet peeves is when we have a parent come in and they say that whoever tested their hearing at the hospital said that they didn't really need to worry about it if they didn't pass because it was just fluid. So if your baby doesn't pass that initial screening, it's not necessarily time to panic. We definitely don't want you to worry over much. However, it is important for that baby to come and get a second screening. A lot of times that's done in the hospital. The difficulty is when people discharge from the hospital before 24 hours. And so maybe they only had the chance to do that screening one time and the ears hadn't had a chance to clear out. It could be just fluid. However, if the person that's describing the test results to you says, it's probably just fluid, don't let that deter you from following up. It's still extremely important to follow up from a newborn hearing screening.
Yeah, I think it's the dismissiveness. I think it's okay to say everything that you just said. Like it is possible. The false, what's the word? The false positive. Is that what it is? The false positive rates of the screenings are pretty high for those reasons. But it's nothing to be dismissive about, because 1 out of 3 of 1,000 children, it actually turns out to be true that there is hearing loss and there needs to be a diagnostic exam completed. And it's for those reasons that there's actually usually a 2-step process for the newborn hearing screen. You'll be screened before you discharge. Your baby will be screened, I should say, before they are discharged from the hospital. And if they refer, because of all of those factors that could be playing a role, they're usually recommended to come back as an outpatient for a second screen. And it's usually when they refer on that second newborn hearing screen that then you'll have those recommendations made to you to go to a pediatric audiologist and get those diagnostic exams completed.
Yeah. Yeah. Now, if you have a child who is born at a hospital that for whatever reason doesn't do the newborn hearing screen, or you discharge before the newborn hearing screening is done, or you give birth at home, I mean, there's lots of different reasons that maybe your child didn't receive a newborn hearing screening. Typically, the pediatrician, hopefully, will recommend that newborn hearing screening be completed. We like to definitely have that done, if at all possible, in the first 2 weeks of life. There's a really important reason for that, and I believe that we'll be creating a video on this, but there is a very common cause of pediatric hearing loss and it's due to an infection called cytomegalovirus. And you can only really determine if that is the cause of it if the hearing loss is detected and a cytomegalovirus or CMV titer is drawn before 3 weeks of age. That's the only way to find out, really,
if it's congenital.
If it's congenital, yeah. A CMV infection, and again, we'll go over this in another video, but a CMV infection acquired after birth doesn't cause hearing loss. So that's why it's nice to know if it's congenital or if it's acquired. And that can only be done if the child is under 21 days. So that is one of the reasons why there's such a push to get a newborn hearing screening done really, really quick after birth. So if you didn't get one in the hospital, sometimes it can be done at the pediatrician's office. Midwives often do these tests. So definitely check into that. And I know as a new parent, you've got a million things going on in your head and you're getting information from all over and you're getting a lot of paperwork. But this is something that is just so time sensitive and really is so important to rule out hearing loss. And if there is a hearing loss present, we definitely want to know that right away in a very timely manner. So there is a time sensitivity to it.
Right. And I do have to put in my own plug about babies who are in the Neonatal Intensive Care Unit. Neonatal Intensive Care. I don't know how it's pronounced. The NICU. Okay. So babies who are in the NICU, especially intensive NICUs, because of course there are different, I mean, NICUs are NICUs, but sometimes babies are there for a day to monitor something, and it's not, I mean, it's always a big deal to the parents, please don't get me wrong, but it's not as extreme as other babies who are maybe in there for months and months. It's really hard to do newborn hearing screens for babies who are at that who are needing that level of care because their bodies are just so fragile, and we don't want to cause any harm. And so for that reason, newborn hearing screens can oftentimes, if your baby is in the NICU, be put off for quite a long time. And if that's the case, that's okay. It is still a law in most states here in the United States that it be done. So I would still make sure that before you go home, something is done. But it's okay to wait and let your baby grow for a little bit and get to a physical state that doing a newborn hearing screen won't cause any harm.
Yeah, absolutely.
Yeah.
Yeah. So as you may be able to detect, we're both very passionate about this subject. We've both worked in hospitals who've had well baby and now you've got
I don't know which one it is.
Now you've gotten me all. I know this.
NICU,
Neonatal Intensive Care Units. And we're very passionate about early detection and intervention as well. And so if you have any questions about this, if you're not sure if your child had a newborn hearing screening, the pediatrician should be able to tell that, or records from the hospital should indicate whether or not they have. But if you have any concerns, contact an audiologist. They can typically do a quick newborn hearing screening in 10 minutes, maybe. I mean, that's about how long it would take us, if that.
Yeah, for us, it'd be a lot faster.
Depending on
the age.
Yeah, depending on the age.
Baby.
Yep,
yeah.
Absolutely.
So those are our thoughts on newborn hearing screens. If you have any questions about anything that we've said, please feel free to comment below and we will be as responsive as possible, or please ask your pediatrician or managing audiologist for follow-up questions that you may have.
Yeah, and if your child didn't pass the newborn hearing screening, we actually did a video on what comes next. So you'll see the link coming up and you can click on that, and then you'll know what to expect for the diagnostic testing portion for your newborn and for yourself.
Wonderful. We hope you have a wonderful day.
Thanks, everyone. Bye.